Hello, I'm Dr. Gokmen Ozturk, the expert of bariatric surgeries. I would like to talk to you about how to perform bariatric surgery. In the beginning, surgical system is conducted as follows. Our consultants communicate with the patient and get all details and necessary information, then deliver this information to us. And then doctors check the information and figure out the patient's needs and what they must do during the procedure in order to make the patient lose weight. The techniques we use, the advices we give the patient, or what we should do, all comply with international and scientific standards of bariatric surgery. We do not do anything outside international and scientific standards under the slogan, "We can do it." And we always try to stay away from guesswork. What I want to say is that our operations are conducted according to international standards. If the patient finds that he needs the surgery, and after making the necessary assessments and finding that he is suitable for bariatric surgery, we contact the planning department and bring the patient to the hospital. During the initial interview before the surgery, we run the tests and evaluate the patient's desires. And according to this information, we decide to perform the surgery. The Turkish Ministry of Health has set many standards to improve the quality of the surgery, and based on these standards, gives permission to hospitals that meet these requirements. At our hospital, we perform surgeries in sterile and wide operation rooms that allows various surgical procedures to meet these conditions. All surgical instruments that we use during operations are made in the United States and conform to international standards. After the operation, the patient is transferred to the care room and is followed up by the nurses. Patients who have undergone any surgery in our hospital feel very happy after completion and after seeing the results. We do not cut off communication with our patients. Our medical advisors continue to communicate with them and provide support and advice. Because we are a health institution, always striving to maintain contact with patients, we provide all means of communication before the operation with medical advisors and with me, the doctor, and with the planning department that displays the hospital and the operation room and medical staff to the patient before the operation. Also, due to the importance of the language of communication, our medical staff provides support in the patient's mother tongue through our team of interpreters. After performing the operation and seeing the results, the patient comes for review, and this is also coordinated by our team. Natural Hair Turkey Hospital is one of the hospitals that considers professionalism in its work, so it provides full support and all necessary services before the procedure, such as transferring the patient from the airport to the hotel and hospital, and during the procedure by providing a world-class operation room, and after the operation through support, follow-up, and tips. If the patient decides to have surgery at Natural Hair Turkey Hospital, our planning department will transfer him to the hotel, the next day to the hospital for tests, and on the third day, he will be taken to the hospital for the operation. The patient remains in the hospital for 2 or 3 days after the operation to rest, and on the day of the departure, the planning team is waiting for him to be transferred to the hotel again. The patient then rests for a day or two at the hotel, and the next day comes to the hospital again for examination. After the completion of the review and examinations and confirming the patient's condition, he will be delivered to the airport and contacted upon arrival to his country to follow up his condition by phone or WhatsApp. This is done by the team of Natural Hair Turkey.